Brain Chat. I'm Dr. Mitzi Joy Williams, your board certified neurologist and fellowship trained multiple sclerosis specialist. My mission is to engage, educate, and empower those impacted by chronic neurologic conditions to become an active part of their healthcare team. Here on Brain Chat, we'll be discussing all things brain health, wellness, self-advocacy, and how to care for your loved ones who are impacted by chronic neurologic conditions. Join me and my super friends and special guests as we get ready for the next episode. And most importantly, let's get nerdy. All right. Hello, Brain Chat friends. Thank you for joining us for another episode. I'm Dr. Mitzi Williams, a nerdy neurologist, and I am so excited to have a very special guest with me today, Dr. Maima Akinsanya. She is an amazing fellowship-trained neuroimmunologist who is now working in the Georgetown Health System in the DMV and doing some amazing things in terms of research as well as advocacy for MS amongst a variety of diverse populations. Welcome, Dr. Akinsanya.
Thank you so much. Thank you for having me. Excited
Welcome
to be
back
here.
to Brain Chat.
Yes. I would like to think I'm a friend of Brain Chat.
Yes, you are. You are not new to this. You are true to this. So we appreciate you coming on. And so in the first part of the year, we usually do an MS 101. So we're a little bit behind. We usually start that in January. But I think it's a really good time to do an MS 101 because we just had some new diagnostic criteria that came out. And I had a great time talking with Dr. Annette Okai about our diagnostic criteria a couple weeks ago. So tell us a little bit about yourself, and then we'll get into some of the, discussion about, today's topic.
Absolutely. So, like you mentioned, I'm currently in the DMV, specifically seeing patients in DC and Maryland. I'm part of the Georgetown system as an assistant professor and see patients through the different MedStar clinics. I'm the director of the MS clinic at MedStar Southern Maryland location in Clinton, Maryland, which is in PG County. And it's been a great opportunity building the clinic there and really introducing, number one, specialized MS care to the community, as well as the opportunity to participate in clinical trials. So that's another one of my focuses is really increasing diversity in MS clinical trials, particularly in patients from underrepresented race and ethnicity backgrounds. So very excited to be here and talk with you today about MS and making sure people are aware of what MS is and, all things MS.
Yeah, I love it. I love it. And so important, because I think, even though we talk a lot about MS, we know our colleagues from across the country, actually the MS community of specialists is very small. So if you go to a couple of meetings over a year, particularly in the States, you can meet almost everybody that does MS. And so it's a good thing, but it's also a bad thing because that means that we need more people treating
Right.
MS and specializing. So thank you for all the amazing work that you're doing. And I think it's so important for us to make sure we're raising awareness about MS, particularly in underrepresented groups, because MS has traditionally had a certain face that people associate with it. And it's not faces that look like yours or mine.
Right.
We think about the prevalence of MS around the world. We know that there's a high occurrence of MS, in certain parts of Europe and Eastern Europe, but there's a lot of MS in the United States. And the MS in the United States doesn't look like it looks in Eastern Europe in terms
Right.
of the different backgrounds of people who get it, but also in terms of the way we treat the disease, the patterns, what medications we have availability of. And so I think it's important to recognize, and when we talk about representation in our research, that we're talking about all different kinds of representation, people that live in rural areas. We're talking about people who are from gender and sexual minority groups. We're talking about people, who are lower socioeconomic status. We're talking about people who are over the age of 55, which
Yeah.
I always say 55 is not old because I'm closer to 55 than I am to 25. But, there's so many unmet needs. And so, it's so important for us to raise awareness so people know if you're having symptoms, you need to get checked out because we want to catch people as early as possible.
Yes.
And we want to treat them as early as possible. We want MS to be a household name. People know about
Yeah.
diabetes. People know about high blood pressure. even though it's much less common than those things, you need to know about MS, right? Because if your brain and your spine are affected, we need you to be on top of that. So
Yes.
let's get into it. All right.
Yes.
So when we're thinking about raising awareness about MS, let's just start with a basic definition. What is MS?
Yeah, absolutely. So, multiple sclerosis is what I usually tell my patients. It's an autoimmune type of disorder. So, what happens in conditions that affect the immune system? Your immune system is supposed to focus on viruses and bacteria. So,
Mm-hmm.
any outside invaders to your body, that's what your immune system is supposed to say, hey, this is not one of us, and we're going to attack it so that, something like a cold does not completely take you out because your immune system recognizes that, for example, the cold virus is not part of your body
Right.
and is able to attack it. Even though you may have symptoms, it shouldn't be enough in a healthy immune system to really put you down. But there are autoimmune type of disorders like MS where the immune system gets confused. So instead of only looking at outside invaders as something to be attacked, the immune system gets confused and looks at the outer coating of the nerves in the brain, the spinal cord, and sometimes the eye.
Mm-hmm.
It thinks that this is abnormal, this is an outside invader. And the specific part of the nerve that the immune system attacks in MS is called myelin.
Mm-hmm.
And the example I often give, and I think I've heard you give this example as well, is if you, I wish I was in my office so I had a cord, but if you have an electrical cord that goes from the computer monitor to, whatever outlet, if you completely cut through that cord, screen, the computer screen is going to go black because there's no more electrical current
Mm-hmm.
flowing. But if instead of cutting through the cord, you get like a knife and you nick the outside, the insulated part of the cord, and not all the way through the electrical wiring, the screen is still going to work, but it might be kind of glitchy.
Mm-hmm.
You might have to fumble with it. That's because the electrical signal is not going to flow as well when that insulated portion it was damaged. So that's basically what happens with MS. The immune system attacks the myelin, which is the outer coating of our nerves. And depending on where in the brain, the spinal cord, or the nerves in the eyes that is impacted, that's what symptoms you'll get.
Absolutely. And I want to get into symptoms in just a second. But before we get into that, you said something that I think is really important. You talked about how autoimmune diseases abnormally affect the immune system and how a healthy immune system is supposed to act. So we know with autoimmune diseases, the immune system is not acting properly. But
Mhm.
I do have a lot of patients that come in and think that because they have MS, not with medicine, that their immune system is suppressed, which is not
Mhm.
true. So can you talk to us a little bit about that? So MS itself is not suppression of the immune system. I tell them your immune system is actually doing the most. It's doing what it's
Yes.
supposed to do and it's doing extra stuff. So tell us a little bit more about that.
Yeah, that's a very great point. So, your immune system, like you said in MS, is not suppressed. It's what I like to call dysregulated.
Mm,
I also don't like to say it's hyperactive because I don't think
mm,
that's the best way to describe it,
mhm,
but it's not doing what it's supposed to do. So, it's only supposed to focus on these outside invaders, but instead, it's what we call, again, dysregulated, meaning it's, you give it, the immune system has this few set of tasks, and it's adding in tasks that are not part of its job description, if you will.
mhm.
So yeah, I like your description. It's doing the most, it's doing too much. And instead of only looking at foreign invaders to the body or outside invaders to the body, it's looking at your own body and getting confused and thinking that this is foreign. So your immune system is still working in MS. It's just not working as it's supposed to, but it's
Mhm.
not that your immune system is suppressed.
Absolutely. And I like that off task. I'm going to give you credit the first time I use it and then I'm going to steal it. So I like that because everybody knows what it means to be off task. Okay. So
Mhm.
your immune system is off task.
Yes.
And so I think that that's a really important distinction because some people come in and they're frightened because they're like, oh my
Mhm.
God, my immune system is suppressed. Should I be concerned about this? And I'm like, well, it's not suppressed. It's just doing stuff it's not supposed to be doing.
Right.
So we talked about, you touched on how MS affects the central nervous system, which includes the brain, the spinal cord, and the nerves to the eye. And the symptoms that are exhibited are based on where that damage is done. Can you talk about a couple of the most common symptoms that we see with multiple sclerosis?
Absolutely. So, some of the common symptoms we see: weakness, especially if it's on one side of the body. So,
Yeah.
what does that look like? That could look like your right hand. Let's say if you're right handed and you usually have no issues, all of a sudden you keep dropping items out of your right hand or tripping over your right foot. And that's never been an issue before. You don't have any reason for that type of weakness. And sometimes people have the right hand, the whole right side of the body becomes weak. But we see weakness, particularly if it's on one side. That's definitely a red flag for something like MS. Numbness or tingling on one side of the body is also a red flag. So if the fingers in your right hand and foot, the fingers in your right hand, toes in your right foot, all of a sudden numb and tingling, or even your whole arm or leg, that's also a red flag for MS. Sometimes you can have symptoms on both sides of the body, but if it's on one side, that's definitely telltale symptoms that could be attributed to MS. Other common symptoms we see are vision issues. So people can sometimes have double vision or even vision loss in one eye, particularly if the optic nerve, which is the major nerve that helps us give us vision in our eyes, if that is affected by MS, we can see vision loss. Other symptoms we see are even bowel or bladder, meaning urination issues. All of a sudden, you're urinating too frequently. You're having an urgency, meaning when you have to go right away, or even incontinence, which just means you're having accidents. That can happen, particularly if you have spinal cord lesions. That is common in patients who have spinal cord lesions. And then people with MS can have constipation as well. Some of these symptoms are not necessarily by themselves, but if you have multiple of these symptoms, those are definitely reasons to be evaluated by a neurologist and to specifically ask if MS is a possibility.
Hmm. Yeah, and
Um,
I think it's so important. Go ahead. Go ahead. Go ahead and
Oh, I'm
finish.
sorry. I just realized I didn't mention some other symptoms, like balance issues
Mhm.
are pretty common with patients with MS, and even like tripping and falling, issues with coordination. Those are other issues or other symptoms to look out for.
Absolutely. So, you know, basically, almost anything that affects the brain and spinal cord can be a symptom of MS. And
Right.
so I think the bottom line is that people need to pay attention to their bodies.
Hmm.
Many of the symptoms of MS can be common to other conditions, which is why some people get misdiagnosed. And also why some people come and see me and I'm like, you don't have MS, but you got
Hmm.
bad degenerative disease or arthritis in your neck, and that's what's causing this. But I think the bottom line is if something is wrong, get it checked out. It is
Yeah.
not normal for parts of your body to go numb. It is
Right.
not normal for you to be tripping over a foot. I have people that come in all the time that are like, well, I just thought I was getting old. And I'm like, but you're 20.
Mhm. Yeah.
So, like, why do you think that's supposed to happen when you're 20, right?
Right.
But even if you're 40 or 55, you're
Yep.
still not supposed to be tripping over a foot. And
Correct.
so the key is paying attention to your body. If you're having neurologic symptoms that you've not had before, get it checked out. I'd much rather somebody come and see me and I say, I don't think this is MS. I'm going to send you here or there. We're going to do this. But I'd rather that be the case than you have had MS for a long time and don't get to be seen because you're ignoring and glossing over symptoms that you're having. I think that's a really common issue. So
Absolutely.
people just, blow it off. And one of the tricky things is that oftentimes when people have relapses, and we can talk for a second about what a relapse is, the symptoms will go away. So if you
Mhm.
have really bad weakness or numbness in an arm for 2 weeks and it goes away, that's still not a normal occurrence. And it
Correct.
still needs to be checked out and worked up. So can you talk a little bit about what a relapse is, and what that means and how people can come to diagnosis after they've had a relapse?
Absolutely. So, how we usually define a relapse is a new MS lesion, again, in the brain, the spinal cord, or the optic nerves in the eyes, that is causing new MS symptoms. Sometimes it can cause symptoms that have happened before, but basically a new lesion that's causing symptoms. And usually these symptoms last at least 24 hours if it's due to an MS relapse. So it could be any of the symptoms we just discussed. There's even a few more that are on the list. But if a patient with the diagnosis of MS is having, new symptoms that is lasting more than a day, and I tell people it doesn't necessarily have to be constant, but even if it's on and off for a day or more, typically it'll be a few days to a few weeks. That is definitely concerning for an MS relapse. And we usually evaluate for that with MRIs to see if we see new active lesions. But there are instances where there could be what seems like a pretty clear relapse and we don't see the new lesion on MRI. And depending on the discretion of your neurologist, and or MS specialist, they may decide to treat you.
Yeah, and I think that's important because I have people that have been diagnosed for 5 days and people that have been diagnosed for 20 years. And
Mhm.
we still are asking, what's a relapse? How do I
Mhm.
know when I'm having a relapse? And so that's a really important question. So, moving on from relapse, let's talk a little bit about the types of MS. So, over the past, I would say, 5 to 10 years, really more the past 5 years, the MS community, meaning those that treat MS on a regular basis and do research, we've really kind of shifted a little bit the way that we think about these categories of MS. So I want to talk about the traditional categories because that's oftentimes what people see when they're looking on the
Mhm.
internet and they're looking up MS. When they come in for that visit, they're like, what kind of MS do I have? Do I
Yeah.
have relapsing remitting? Do I have stages of MS? So let's talk about those traditional stages or boxes that I used to call them. And then let's talk a little bit about how we shifted some the way that we think about categories of MS.
Yeah. So I often get that question as well. It's like, what kind of MS do I have?
Mhm.
And traditionally, we described MS as relapsing remitting for patients who would have a relapse and then they would get better, oftentimes back to normal. And then some time would pass and then they would have another relapse or flare up. And that's what we called relapsing remitting. Then we had the patients who we said was primary progressive, meaning they had a set of symptoms that just slowly got worse over time. They never really had relapses. They would just have the same set of symptoms that over the course of years just, would get worse. And then we would say there are patients who are secondary progressive, meaning they started off as relapsing remitting with relapses and then improvement and then another relapse. But then over time, their symptoms just got worse and they were no longer having relapses, but they were having worsening of their symptoms. But where the more we learn about MS, the more we realize we have more to learn. And
Absolutely.
so, what I often tell my patients is we're still trying to understand this disease, and we're learning that having these firm boxes is not always the best way to describe it. And what we do know is that people have relapses and people have progression. And so, instead of being so neatly fit into primary progressive versus secondary progressive and whatnot, we are more likely to just describe whether you have, currently have relapsing disease or progressive disease.
hmm and the interesting thing is that, being a little nerdy, because I am a nerdy neurologist, those original categories were really based on how people behaved physically.
Hmm.
Most of the time, when we think of categories of disease, like when people talk about stages of cancer, stages of other diseases like cirrhosis of the liver, they're talking about the biology, what's
Hmm.
going on under the surface. But, we really didn't know the biology when those
Yeah.
categories came up. So we did the best we could, the scientists that were working at the time. And really, they're describing it based on what a person looks like or how they present to the clinic, but it's not really focused on the biology of the disease, which, as you said, we now know that there is progression and relapses that are going on from the very beginning. And
Hmm.
sometimes we see the relapses more predominant in a group of people, and other times we see the progression more predominant, but people can have both
Yes.
um, during the course of their whole life with MS. And that's really important. And I think that distinction helps us to better understand what's going on under the surface and better explain it to our patient. I think the other thing that is a little bit tricky is, and we're not going to really get into treatments this episode, but with many of our newer treatments that are more effective, we can almost get rid of relapses. And so now when
Hmm.
we see progression. It's like, is your MS progressing, or are we just seeing the progression because we've removed the relapses? So that's
Yeah.
kind of one of the other big questions that we have now that makes it a little bit more tricky. It's a good problem to have,
Yes.
but it is a problem nonetheless.
Mhm.
I also want to talk about, we're trying to identify MS even earlier. So when I was
Mhm.
coming along in my training, it's going to make me sound a little old. When I was coming along in my training, it was very difficult to obtain MRIs.
Mhm.
MRIs are expensive, but
Mhm.
they were really, really expensive. And I remember, being in the hospital, had a patient, and I ordered MRI, and the radiology department would call me and be like, "Do you really need this MRI? You sure you
Mhm.
can't do a CAT scan? Because this MRI is going to be expensive."
Mhm.
And so, like, your eyeball had to be falling out to get an MRI. Now we can get an MRI if you got a headache, if you're
Mhm.
tired. We can get an MRI for just about anything approved through insurance. And so now we're getting people who come in, let's say they were in a car accident or they're having headaches, they get an MRI and the MRI looks like MS.
Right.
They haven't had any symptoms. Let's
Mhm.
talk a little bit about that category, which we call radiologically or radiographically isolated syndrome. Can you touch on that for a few minutes?
Absolutely. So, radiologically isolated syndrome, like, or RIS, is the
Mhm.
acronym that we often use. Like you said, describes if someone has an MRI of the brain that has typical MS type lesions. So we see the location of the lesions and even how the lesions look that are very classic for MS. But when we ask them about all the symptoms we talked about earlier, they say, no, I don't have any of those. And so we don't have any history of a MS flare or MS symptoms in the past, but their MRI looks very classic for what we typically see in MS patients. So that's when we categorize people as having RIS. And in the past, we used to say if someone has RIS, we just will oftentimes monitor them clinically and get repeat MRIs and just see how they do over time. But more recent, research that has been done has actually shown that there may be some benefit for starting some patients on treatment, even though they don't have clinical symptoms, but to help to basically mitigate the risk of in the future developing MS. Because there is about a 50% chance that even though a patient does not have any MS symptoms at the time of identifying that they have radiologic or MRI lesions that are consistent with MS, that they may develop MS in the future.
Yeah. So that's, again, we're learning more and more. So ideally, we want to catch people and diagnose them as early as possible to keep them as normal as possible. So in a perfect world, we want to treat you when you have no symptoms, and we want to keep
Mm-hmm.
you with no symptoms, because each time a person has a relapse, it puts you at risk for not going back to normal. We
Right.
can't predict how much you will recover from that relapse. So we would like for them not to happen at all, so we don't even have to worry about that. And so I think that's been very interesting. And even before that, now we're looking at an MS prodrome,
Mm-hmm.
right? All of this to try to identify who is the person that will go on to develop MS, because with things like RIS, we know that people will develop lesions sometimes for years
Mm-hmm.
before they actually have a symptom. So
Right.
again, we want to catch you before symptoms, but ideally, we want to catch you when you don't have a lot of spots or damage to your
Mm-hmm.
brain that can affect you later on. So the other thing that's being studied, I think, very closely is the MS prodrome, meaning some of our colleagues have identified that up to 10 years before people get diagnosed, they have non-specific symptoms, like they're going to the doctor more for headaches or fatigue
Mm-hmm.
or for other problems that may not be direct neurologic symptoms, but they're having these symptoms and they're increasing going to the doctor. And, is there a way we can identify who we need to get an MRI on to see if they have MS? And we don't quite have the answer yet,
Mm-hmm.
but I think that we're getting there. So it's really important that we're trying to identify people earlier and earlier with disease.
Yeah.
So we've done a lot of talking about what it is, what the symptoms are, what it looks like, what is not. Let's talk about how we diagnose it.
Mm-hmm.
So how do we diagnose MS?
Yes. So there, unfortunately, is not one single lab test or thing that we can do to tell someone with 100% certainty, I know this is MS. That's something I get asked a lot. Like, well,
Mhm.
Is there some one thing that can tell you without a doubt that I have MS? And we don't have that currently. So instead, we look at, the clinical picture, meaning what are the symptoms the patient is having? Is it consistent with what we know MS causes in the body in terms of symptoms? Then the MRI of the brain and the spinal cord, and sometimes the eyes, which is the optic nerves, is also incredibly important and necessary when making an MS diagnosis. We have to have that information to see, do we see typical MS type lesions on the MRI? We often do lab tests to help rule out other things because, there are other diseases that can create lesions that look like MS lesions, but are not actually from MS. So it's also important to make sure you're not diagnosing someone with MS and they actually have another disorder, because that would be different treatment.
What
And
are some of those things that can mimic MS? So when we're doing the blood test, when
Mhm.
we're training people like vampires, shout out to the new vampire movie. But when we're draining people's blood, what are some of the things that we're looking at, and what are some of the things that can mimic MS?
Yeah, so some of the things that we often look for are other, well, not other, but rheumatologic disorders. So
Hmm.
things like lupus,
Hmm.
sarcoidosis,
Hmm.
those are rheumatologic disorders that can mimic MS.
Hmm.
There are even some infections that rarely, like a vasculitis, which is an inflammation or infection of the blood vessels, that can cause
Hmm.
MS type lesions.
Hmm.
Sometimes even migraine headaches can cause lesions that can be misidentified as MS.
Hmm.
So those are in terms of blood work, and then also history and all
Hmm.
that is very important to kind of, any MS specialist will be asking a lot of questions, a very detailed history intake to make sure that, ruling out any of these other common disorders that can look like MS but are not MS.
Hmm. Absolutely. Absolutely. And then what about the person who has a lot of symptoms and completely normal MRIs?
Mm,
I get that one a lot.
yeah.
So I do not diagnose people with completely normal MRIs. Now, I have had a couple of instances where maybe we did a spinal tap and maybe there were some abnormalities,
Hmm.
but for the most part, it's going to be very hard to diagnose with no abnormal MRI. Now,
Right.
sometimes people will declare themselves over time.
Hmm.
Sometimes maybe that first MRI will be negative and we'll keep monitoring, and then we're like, oh, there it is.
Yeah.
To also remind people that MRIs are like mirrors. So you got the mirror that you have in your bathroom, that's your standard mirror. You can see a certain level of detail, and then you go to a really fancy hotel or you go
Hmm.
to Bed Bath and Beyond. That's not is not open anymore. You can still buy stuff online. And then they have the mirror that has 10 times the magnification, and you can
Right.
see every pore in your face. So our MRIs have gotten better and continue to improve, but we don't have the MRIs for daily use where we can see every pore in your face.
Right.
So there could be things that we may miss that are very subtle, but typically we need to see some MRI abnormality to diagnose multiple sclerosis, and that's a really, really common question that I
Yep.
get. Another thing that I think is very interesting is that when I first started practicing, we used to do a lot of lumbar punctures or spinal taps.
Yep.
And so whenever I give a patient talk and I say, anybody had a spinal tap? And they raise their hand, and I say, anybody don't remember? If you raise your hand, you ain't have one, right? Because if you had a spinal tap, you
Yeah.
gonna remember that you had that spinal tap.
Right.
And so we kind of got away from that because our MRIs were so good. But now with our new diagnostic criteria, we kind of going back to lumbar
Hmm.
punctures and doing lumbar punctures again. And that basically helps us if it's positive.
Yes.
Meaning if you have positive oligoclonal bands, which are telling us that your immune system is overactive and you have antibodies in your CNS that shouldn't be there. But if it's negative, it doesn't always mean you don't have MS. And
Right.
then can you touch for a second on some of the blood tests that we're starting to look at? So we don't have a blood test that diagnoses MS, but there are some blood tests that we're starting to look at to help us with the diagnosis.
Yes, there are blood tests that are looking at what we call neurodegeneration,
Mhm,
basically the breakdown of certain proteins that we see in the nervous system, for example, neurofilament light chain,
mhm,
that are, we see more commonly in patients with disorders like MS that are helping us with the diagnosis.
mhm,
Again, it's not going to tell us with any 100% certainty, but when you put together the clinical picture, the exam, which is still important. I didn't mention that, but the neurologic exam is helpful and necessary in the diagnosis as well. The MRI, and like you said, the spinal tap results. Do we see evidence of long-term inflammation in the spinal tap results? And then some of these blood tests that look for, signs of neurodegeneration. When you put all of that together, that can really be useful in the diagnosis of MS and tell us with pretty, good certainty this looks like MS, or maybe something else is going on and other investigation needs to be done.
absolutely. So, unfortunately, we are coming up on our time. That went by really fast. So, we're going to have to do a part two where we
Yes,
talk about
absolutely.
treatments for sure. But, to that new person that's out there, that is either concerned about diagnosis or, just got diagnosed, where would you direct them, to learn more about MS, to get resources? Like, what would be your advice to that person that's just starting out on this journey?
Yeah, that's a great question. So if someone has already been diagnosed with MS, I would say the National MS Society is an amazing resource.
Mhm,
Very large U.S. based society for MS that is geared towards MS patients.
mhm,
There's other organizations like the MS Association of America
mhm,
that has amazing resources for patients as well. For both of those organizations, I often give my patients educational pamphlets that they've created that just help them understand what this disorder is.
mhm,
Um, you can look for a local MS patient support group. The
mhm,
National MS Society, I know on their website, you can like plug in your zip code and they'll tell you, at least in their directory, what some local patient support groups, just to meet other people who have the same diagnosis and
mhm.
make sure that you don't feel alone in the journey and you can connect with other folks. Um, and nerdy neurologist, honestly, and you know yeah, conversations like this are so informative, and I think a lot of the questions patients have are answered in forums like this. So I would definitely direct them to educational material like this.
Mhm,
And I would say for the person who has not been diagnosed and is like, well, I've had some of those things that they talked about today. Do I have MS?
mhm.
Advocate for yourself. If you
Absolutely.
have not already been evaluated by a neurologist, I would, talk to your primary care physician about a neurology, consultation or evaluation.
Mhm,
Um, and if, maybe even specifically a MS trained or an MS specialist, if you
mhm,
haven't had that as well.
mhm,
It's not that, like you said, everyone with these symptoms we mentioned will have MS, but it's important to advocate for yourself and make sure that that has been considered and
mhm.
evaluated for.
Yeah,
So
I
it's
would
not a
agree.
disorder that is going on and on without treatment, because although we don't have a cure, we do have very effective treatments for the relapses, like you said. So that would be what I said to the patient who was not diagnosed. Advocate for yourself and ask for ideally an MS specialist, but at least a general neurologist to evaluate you for MS.
Absolutely. I encourage everyone who has been diagnosed that at some point you should see an MS specialist at some point during your journey. There are many amazing colleagues who are general neurologists who are treating MS and doing an excellent job.
Hmm.
But I would just say at least once see an MS specialist, confirm your diagnosis, and just check in and have your treatment plan. I have some people that live kind of far away from me. I'm sure you have this as well. They may
Hmm.
have a local general neurologist, and they
Yep.
come see me once a year, check in, but getting somebody on board at least once during your journey, preferably on a regular basis,
Mhm.
is really helpful. And then, again, for everyone else out there, listen to your body.
Mhm.
Don't ignore symptoms. These things is not normal for stuff to go numb or go dead or
Mhm.
not work. And so we much rather we say, you know what, you need to get some more sleep than for you to
Yeah.
have MS for 10 years and we don't
Right.
know you have MS for 10 years because you've been ignoring it. So that would be my encouragement. Listen to your body, see a MS specialist. And there's so many amazing, as you mentioned, Dr. Akinsanya, educational tools out
Mhm.
there for people to tap into, get good information. You know, Google can be our friend, but Google can be your enemy. So when we're looking at those symptoms, for those newly diagnosed, I say, do not look up an exhaustive list of symptoms and memorize it because it will scare you to death. And
Yeah.
you'll be calling me and your eyes twitching, and I'm like, stay off your tablet. That's why your eyes twitching, because you on your phone too much, you know. So
Right.
you know, again, so much great information out there. But thank you so much for your time, Dr. Akinsanya. Thank you for your wisdom. Thank you for sharing with our Brain Chat audience. And we're going to have you on real soon so we can do part 2 and we can get into these treatments.
Absolutely.
Where can the people find you in the DMV area if they need to get treated? People ask me all the time, who's in Maryland, who's in Virginia? I'm like, Dr. Akinsanya, you need to go see her. So tell the people where you're practicing one more time before we close out.
Absolutely. So I see patients at 2 locations. Clinton, Maryland is MedStar, this MedStar Southern Maryland Clinic. It's Georgetown Neurology at Clinton. And then I also see patients at the main Georgetown location in Washington, D.C. And we have an amazing network of MS specialists in Georgetown that see, patients throughout Maryland, Virginia, and D.C. But if patients would like to see me specifically, that would be in basically PG County, Maryland, as well as Washington, D.C.
Awesome. All right. And thank you to the National MS Society for sponsoring Brain Chat. Speaking of National MS Society. And thank you to all of you, all of our viewers, all of our listeners, those who are either listening on Spotify or Apple Podcasts, as those who are watching on YouTube. Thank you for taking out your time, and please share with a friend. We'll see you again in 2 weeks.